Dr. Rhonda Randall, welcome to the Valder Beebe Show. How are you today?
It's always great to talk to you. Thanks, Valder. How are you?
I'm good. It's always good to have you. I want my audience to know that Dr. Rhonda Randall serves as the Chief Medical Officer at United Healthcare. And today she wants to talk with us about the importance of a primary care physician. Dr. Randall, let's get started. Why is it so important to have a primary care physician as we age?
Thank you, Valder. I'm glad you asked this question. As a primary care physician and a geriatrician myself, it's important to have somebody be that quarterback of our healthcare as we age. It really becomes more and more valuable to have a doctor who understands you best and knows your full health history over time. Somebody who's going to help you manage a chronic condition, catch things early, work on preventative care, and make sure your care is coordinated.
So having a primary physician, if I could use this analogy, is it like having a relationship? And what I mean by that, people know when you're out of sorts, when you aren't feeling well, or if they know from your prior test results that they can look up. Is that how it is having a primary physician?
You're absolutely right. One of the biggest benefits is in that prevention. The regular visit with a primary care physician is not just about treating illness, it's about catching something before it becomes more serious. And your PCP is going to not only do those screenings and make sure that you're up to date on your immunizations and other routine checkups related to your health, but they're going to spot those changes in your health early before they become more serious. That is going to lead to a better outcome, easier course of treatment, and something that people don't always think about, but lower costs for you down the road when you catch something early.
I understand what you say about the benefits of the relationship, but some people only see the doctor when they're sick, though. How can that help them or benefit them?
That might have been fine when you were younger and didn't have a chronic health condition, but as we age, there are a lot of screenings that we need to make sure that we're keeping up on. And most older adults, more than 90%, have at least one chronic condition, and many are living with more. So I'm talking about things like heart disease, diabetes, cancer, chronic lung disease, and others. And having somebody who's going to help manage your medications, make sure that the different specialists that you see are working together on your behalf and not in silos. That kind of care can avoid an unnecessary or a duplicative test, for example, medication interactions, and unnecessary procedures. All of this can be stressful for you and your caregiver. So that primary care physician is helping guide your care to the right place at the right time, which can help it be more efficient as well as more affordable for you. So that relationship that you mentioned earlier pays off for your health as well as your budget.
Okay, I'm going to take this one, Dr. Randall, and I think you remember that my audience is made up of people born between 1946 and 1964, affectionately called baby boomers. And they have a lot of questions that I told them that you were coming. And one of the questions that's coming from Instagram, the poster says that he has a great primary care physician who will do referrals to other doctors. But the chart system that its primary physician uses cannot be accessed by the specialists or the outside doctors. So they end up with a lot of charts. Any suggestions? Oh, that's a good one.
Look, it's a great question. It's so important to make sure that that care is coordinated, and more of those electronic medical records have abilities to share certain amounts of information with each other. But this is why it's important to have that relationship with a primary care physician so that they're communicating that most important information with each of your specialists and getting it in return so that you have that individual physician who's looking across all of those different areas and aspects of your health. And some things that some electronic medical records really add a significant amount of advantage to our health. And then there's other places where they're not quite as evolved as we want them to be, but they're on their way there.
Okay, there you go, poster. Okay, what if you don't have a primary care physician? We didn't talk about that.
Yeah, establishing a relationship with a primary care physician is so important. So, you want to start by considering what matters to you. What's important to you? Is it somebody who is close to your home? Is it someone who is in your health plans network? Is it somebody who has great referral scores from other people who are like you? Is it all of those things? A good place to start is with your health plan, either through their mobile app, their online web platform, or by calling that number on the back of your card can help find a primary care physician who's a great fit for you. And what you can expect when you have that first visit is them to take a thorough health history, review all of your medications, and then become that trusted point of contact. This ties back to the question that you asked earlier. Once you have an established relationship with a primary care physician, if you're not feeling well, they're often able to bring you into the office and get you in rather quickly, as opposed to somebody who doesn't have an existing pre-established relationship.
Okay. Before I let you go, I'm going to take this one from Facebook. The author said that you said you're a geriatric doctor. What do you see for health care and those people that Valder mentioned, those baby boomers, in 2026?
That's a great question. I often get a related question to this is who needs to see a geriatrician? And geriatricians are a type of primary care physician that specialize in the care generally of people who are more frail as they age. So primary care physicians, important for everyone. Geriatrics is a much narrower specialty. If you think about somebody who needs assistance with any of their activities of daily living, that's when getting a comprehensive geriatric assessment can add a lot of value. But what I see as far as the future for older Americans, I think it's bright.
Dr. Rhonda Randall, online, where can my audience get some more information?
You can get this and more information at uhcmedicarehealthplans.com.
I want to thank you so much for always stopping by the Valder Beebe Show and making us smarter and more aware. Have a great morning.
You too. Be well.
Hi, I'm Valder Beebe, host of the Valder Beebe Show. We have over 1,000 videos on ValderBeebeShow.com and YouTube.com/Valder Beebe Show. We upload new videos daily. Our site is a modern baby boomer platform with news and information important to boomers. Subscribe to YouTube.com/Valder Beebe Show and stay connected as I interview the world's most fascinating people.